Hi everyone, welcome to PBMT for the foot and ankle. Today we're going to be talking a little bit more about plantar heel pain syndrome. We're going to state the patient positioning for treating plantar heel pain syndrome and then discuss the protocols that may be utilised for plantar heel pain syndrome as well. So what's in it for you? Hopefully you'll be able to understand a little bit more about how I treat plantar heel pain syndrome and a little bit more broadly about how you can use your PBMT device, whether it's similar to mine or slightly different. And we'll go through a little bit of that today as well. Basically, what I want you to think about is, plantar heel pain syndrome more broadly is made up of our traditional plantar fasciitis, a plantar fat pad syndrome, maybe there's some tarsal tunnel syndrome, and then, maybe there's some Baxter's nerve entrapment and a few other different aspects there, but some calcaneal nerve entrapment, tibial nerve entrapment. And so we really want to, think more broadly about how we're treating this. And that'll be sort of how we approach all of our conditions when we use PBMT. Okay, so what we're looking at is just tilting the patient back a little bit, putting them in a comfortable position. But for my type of laser and how I go about it, it really allows me to make sure that I'm able to get that plantar surface of the heel a little bit easier. For those that are just using a handheld device, consider where the best ergonomics are for you. For mine, that's robotic, although sometimes I'm using my handheld side. You need to just be really aware of what you're looking at and where you're treating as well. For the plantar heel, really you're wanting to get rid of any swelling that's there. And this may be only for 3 to 4 treatments before moving to something, like pain. But really focusing on that anti-edema where you can will put you in a good position. Think about that plantar fascia, the whole area, and going from our medial band through to our first MTP is typically the type of plantar fasciitis that I'm seeing. And so I'm going to use some type of setting that's going to reduce the contracture. In the case of the MLS M8, it is a contracture setting. But then also don't forget to think about your more broad aspects here. Think about that gastrococceleus or the flexor hallucis longus that may be impacting, and use some trigger points. Maybe the plantar fascia has some trigger points, or our quadratus plantar. And then, definitely consider, whether you want to release those calves a lot more using something like a biostimulation just to get energy and healing going on, as well as, a contracture setting to increase that range of motion and, allow a lot more, flexibility through those calves. So let's take a look at what that might look like. Here you can see me using a contracture setting with the M8 on the plantar foot. And you can see that I'm really extending all the way down from that more inferior aspect and then starting to come up. In contrast, here I am just with my anti-edema, really focusing on that plantar heel. Now think about that triangle as something that you're not seeing when you're looking through your glasses because we'll have glasses on, but definitely on the video here we do capture that, and that's the whole treatment area. So do consider, depending on your device, that yes, there's going to be an area of dispersion and we're wanting to really treat there as much as we can. Now, of course, these are different protocols that have worked for me and I find that they're pretty effective. Do consider going more broadly and really thinking, okay, well, is there neural entrapment? That might be tarsal tunnel, Baxter's nerve entrapment, and then bringing those in, okay, where are they potentially getting entrapped? Our flexor hallucis longus may be causing some, extra sort of pressure or compression into the tarsal tunnel, or it could be a space occupying lesion, such as a ganglion, maybe off the posterior subtalar joint, and start thinking, okay, what's happening there? Why is it there? Is there something that I can do as well? Because more broadly, we want to make sure that yes, we are reducing the edema, we're reducing that contracture, we're freeing up this sort of plantar heel area, but we also want to look more proximal and more broadly at the biomechanics and treat holistically in the way that we look at plantar heel pain syndrome. But hopefully this has helped you bring together a few of your, a few of the ways that I treat plantar heel pain syndrome. And I find that this is quite effective in the approach there as well. Of course, I'm going to be doing, 2 to 3 sessions per week, initially for that 2 to 3 weeks, potentially up to 4 weeks, seeing how patients respond, then maybe drop it to once a week, and then, hopefully down from there in conjunction with all of our normal supplementive and complementive devices such as orthoses, and going from there as well. But hopefully this has given you enough information on the laser side, and we'll see you at the next session. Cheers.